All right. Well, we'll keep letting people come in as they get here, but I think we can get started here. So, welcome everybody. Thanks for coming to IPHA's Third Thursday Lunch and Learn web series, organized by the IPHA Education Committee. We like to dedicate this time every month to sharing our successes, even some of the difficulties that it might take to get there, because those can be helpful too. The point is to connect, learn, and strengthen the voice for public health in Iowa, which of course is part of the mission of IPHA. If you're a member of IPHA already, we thank you for that. If you're not yet a member, we invite you to join us and help carry out our mission. You can do that on our website at iowapha.org. Today we're talking to Angie Doyle Scar and Abby Less from the Iowa Department of Public Health. They will share about the relationships between public health and public libraries through a new program that they launched just a couple years ago. But before we get started, just a couple of housekeeping items. Your microphone is muted right now and your video is turned off during the presentation. This will help keep enough bandwidth while they're speaking. You can put your questions in chat or the Q&A features. And then there should be some time afterwards if people would like to unmute and have an open conversation or questions, you can do that. The session is being recorded and will be posted to IPHA's YouTube channel shortly after. But now I'll turn it over to Angie and Abby to introduce themselves and tell us about public health and library partnerships.
Hi, everyone. Thank you so much for inviting us to come and talk about this project of ours. It's actually one of our favorite passion pet projects, so I'm always excited to talk about it. Again, my name is Angie Doyle Scar. I work at the State Health Department. I've been there for almost 20 years and have worked on many various projects. Abby, do you want to introduce yourself?
Yep, I'm Abby Less. I work for the Iowa Department of Public Health, and we are in the Bureau of Policy and Workforce Services, work on different special projects, this being one of them. Turn it over to.
Yep. So we have a couple pilots that we're going to talk about in a couple minutes. The idea behind trying to create this collaboration with local public health and local libraries first started when our former director, Gerd Claybaugh, brought together an internal group. He was looking at a potential federal grant that actually never did end up opening up or panning out. But he brought us together to look at creative ways to start to look at social determinants of health in Iowa. As somebody, I've had a love for libraries. I was one of those kids who voluntarily used to hang out at the library. And so my love for libraries and then my 20 years of love for public health, I started thinking about how important both of them are, and they're the foundations of local communities. And if we could get them to work together, wouldn't that be amazing? So I brought the idea back to the internal group. I brought it to Abby. Abby loved it. So Gary at the time said, come up with a proposal. And when the federal grant didn't happen, he said, well, if you guys can find funding, then go with it. So that's what we did.
And so the funding we got came from Intelligent Community Initiative. So I'm just going to give a little bit of background about them. This is an organization that offers grants that support innovative and forward-looking health-related projects aiming at improving health, social well-being, and educational attainment. So IDPH's project was one of 18 grants selected for the 2019 grant cycle, which we were awarded. We were awarded $50,000. It was originally a one-year project, and COVID was in the middle of it, and we got a 6-month extension. So it does come to an end here next month. Intelligent offers these grants to 4 states each year: Colorado, Illinois, Iowa, and Oklahoma. And here is Intelligent's website in case you're interested in reading about some of the other projects that they have funded. So the project, we titled it Harnessing the Power of Iowa's Libraries. The goal of the project is to support and equip Iowa's libraries with the tools, resources, and programs to collaboratively address social determinants of health gaps and improve population and public health. I'm sure everyone on this webinar probably already knows that local public health agencies and local libraries both are trusted resources and are at the heart of most communities in Iowa. Both entities, oh, go ahead.
I'm sorry, I just to jump in, because I should have said in the introduction. So one of the first things that Abby and I did is we try to do an environmental scan to see if we could model after current existing projects. And what we found was that there may be there was like a project in Colorado that had a health navigator in the library. So they were very focused, and not the collaboration that we were hoping to start in Iowa. The only place that we did find something is Philadelphia, and Philadelphia has a wonderful program. So we were kind of going into this with a blank slate. And so I think we talk about it in one of the future slides, that we really wanted the communities then to decide what this partnership looks like. Sorry, Abby.
Oh, that's okay. Yeah, both libraries and public health, we kind of did a review, and we know that they both have such strong relationships with a wide variety of community partners. Okay, so the project is partnering with local public health agencies and local libraries. The goal is to expand services that are offered within the library to have a focus on health. In many communities, both of these types of organizations are already doing such great things, but independently of one another. This project kind of focuses on having them join forces. So we've established 2 pilot project sites, one urban, one rural community. The pilot locations include Cedar Rapids Public Library, working with Lynn County Public Health, and Perry Public Library, working with Dallas County Public Health. And we did receive a small grant from Delta Dental of Iowa that we added a site in Woodward.
Yep.
So here are the key project activities. So at the very beginning of the project, each of the pilots reviewed their community health needs assessment and health improvement plan to identify at least 3 new services or programs to offer within the library. We also conducted a survey of library staff at each of the 2 pilot sites to learn more about the needs of the patrons and resources within the communities. And one of the questions that was on this survey was, do your library patrons even ask about health-related questions? And the overwhelming majority said yes, they do, and they would love more resources to help connect the patrons to community resources and resources within the library. Another project activity is to evaluate patron satisfaction, and we're also in the process of developing a toolkit that will include best practices, success stories, to eventually, the goal is to replicate this type of project in other communities across Iowa. Okay, so Cedar Rapids Public Library, they hired a navigator to help address the needs of unmet social needs that impact the health of their patrons. They are also offering health and nutrition classes focused on healthy cooking on a budget. They also implemented a Growing Readers Prenatal Care Program, which provides tools, resources, and support for prenatal care. And then also these physical activity kits to patrons, which provide resources promoting a variety of activity. This picture here is one of their activity kits that includes a exercise ball and a pump and instructions. They said they have enough kits to reach 80 patrons, I think per week, they said. So one of the success stories from the Service Support Navigator, I'll read it real quick. The patron had experienced homelessness off and on for the last 3 to 4 years, lost his job, falling into depression and alcoholism, and has not been able to stabilize. The Service Support Navigator is within the library. He has interacted with the patron daily. The struggle with alcoholism was apparent, and the Service Navigator worked to minimize the harm he was causing himself and others. Daily library rules reminded him were a norm, and the support was also given providing transportation to the overflow shelter, where many of the homeless individuals are providing a safe place to stay during colder months of the year. And also they utilized this shelter during COVID when the library was closed. The prevention that was offered caused not calling the police on a regular basis regarding the patron's behavior. The navigator was able to keep up a repertoire with the patron while enforcing the rules of the library, and there was a mutual trust and connection established between the patron and the navigator. Through this continued contact, the support navigator has been able to work with this patron to obtain housing along with employment as a City of Cedar Rapids ambassador, thus helping obtain work skills needed to transition to a more permanent employment.
So one of the things that Cedar Rapids pointed out to Abby and I, and neither of us are from Cedar Rapids, but there's a park, the large city park right across the street, which is commonly used for the homeless in their area. And so they will then come over to the library and use the library, the internet or stay warm. And the library wanted to continue to offer those services, but then also be respectful to the patrons. And so this navigator has been able to not only accommodate both those needs, but then also help way beyond, the needs that they're presenting at the library.
And both pilots have actually been featured in the local news. This first bullet is a link from the Gazette featuring an article on the project. And then I'm also going to play a short news video that features a story on this Cedar Rapids, the project and the supports navigator. So let me pull that up.
When someone is homeless, many of the challenges they face go beyond just finding shelter. There's now a new resource at the Cedar Rapids Public Library to help with issues like health care and employment. KCRG TV9's Taylor Holt joins us in the newsroom tonight to explain. Taylor?
The library's support services navigator started at the beginning of the year, and his task is pretty much what it sounds like, to help navigate clients through some of the lowest points in their lives.
Yeah, well, this evening now? Yep, I've been there. This will be my third night. Yeah. How's it going so far? Pretty good.
This is a typical day of work for Aaron Turonis, checking in with clients like Dan Fleming, who's been staying at Willis Dady for a couple days now.
So you're getting along with everybody then? Mm-hmm. Awesome. Most of those shelters are only open at night, so during the day, this is the only place where they can stay, where they don't have to spend money. So a lot of the time, they just need resources here.
As the new support services navigator here, that's his sole purpose.
From about 3 p.m. to 6 p.m. is when sometimes it can get a little hectic around here, and that's when I really like to be on the floor, walking around, just checking in on people, seeing if they're having concerns, if they're having a tough day, just trying to figure out what's going on with them.
More importantly, he's tasked with providing services for anything from getting clients on the rapid housing list to help get them financially into a new place, to transportation to medical appointments or the Social Security office.
I can provide them transportation to the meal sites and make sure they know where all of that is, especially for people who are new to the area. Every person that is experiencing homelessness has their own story, and it's very different.
For Mike Hyatt, who's been staying at their overflow shelter, his first priority is finding a ride to get his Social Security check.
If I got here about noon, would you be able to head right over? Sure.
Then figuring out the next steps once he gets them.
Start with a vehicle. Obviously have something once the overflow closes. Get around, stay in if I have to.
Ultimately, it's finding work after having gone through some medical issues.
Telemarketing, would that be something you'd be interested in? Anything.
Turonis works through Willis Dady, so he's familiar with many of the clients already and says it helps now that he's seen them more.
The more time you spend with these people, the better the interactions are, the more trust that you can build with them.
He says that and helping them get back on their own feet are the main goals.
Helping them help themselves.
The new position is part of a new partnership with Linn County Public Health that a $50,000 Iowa Department of Health grant is funding. It's a one-year pilot program Turonis says they hope to continue in the future. In the newsroom, Taylor Holt, KCRG TV9 News.
And I just want to point out, and I know I'm preaching to the choir here, but when she says $50,000 grant, it was $50,000 that was, for the most part, split between the two pilots. And again, I'm preaching to the choir that it is amazing the impact and the work that both these local public health and libraries are, they provide a service to the community also, and how much they are able to do with that amount of money. It's just I'm very proud of the work they've done. You can probably, so sorry, I mean, go on.
And with this support service navigator, even though the grant's coming to an end next month, they have found a way to continue to pay him in his position through the city. So they saw the benefit from this and have figured out a way within their own community to sustain that.
Just to add on to that, because this is huge. I mean, this really is huge. We knew this funding was only going to be temporary, and what we were really hoping was to at least start that collaboration and discussion between the local library and local public health. They both have the same mission to serve their communities, and how they serve them looks differently. So what I was hoping, and Abby was hoping, is that they could see how this partnership could actually help them both meet the needs of their mission. And so now that this relationship has started, and they've made it very clear in both of our local pilots that once this funding is gone, the relationship is only going to get stronger. And in Cedar Rapids, they were actually able to go to their council, Cedar Rapids Council, and it is now they've incorporated this in part of the library's budget to keep a lot of this programming going on. So that is a huge, and I know that a lot of you understand how difficult it is to get anything added to your budget. And so that's huge.
Okay, so some of the things that Perry Public Library is doing. So Perry is a town in Dallas County of about 7,000 people. This pilot site makes up kind of the rural component of the pilot project to Cedar Rapids' urban counterpart. They may not consider themselves rural, so we also added the Woodward to make it rural area. So in March of 2020, Perry Public Library launched the Perry Food Recovery Program. This program, through collaboration with local grocers and volunteers, brings nutritious produce that would have otherwise been wasted to Perry residents. So an open front industrial size refrigerator was placed in the atrium of the library where anyone in the community could access it during the 50+ hours the library was open each week. So the program both increases access to fresh produce and reduces food waste within the Perry area. Here you'll see some photos of the refrigerator, and I know it's a huge hit in the community. Once they put food out every day, it's gone by noon. People love it. Another thing that they have done is called a story walk. So they built a story walk in, it's called Wees Park, in where children and families can enjoy reading and the outdoors at the same time. So pages from a children's or any kind of book are mounted on posts around the park so that families can walk around the path and read the pages of the book together. We just recently spoke with Mary from Perry Public Library, and she saw how much the community loved this in that park, and so they're also working on eventually putting some of a story walk around their actual library. They also have a fresh fruits and vegetable outreach program. This program has placed fruits and vegetables into the hands of Perry residents throughout the summer farmers market. This program allows community members to try new fruits and vegetables without any financial barriers. So there's a picture and some flyers advertising this program. And here is a link to the news article that featured Perry Public Library's project. Do you guys have any questions about what either of the two pilots have been working on?
One thing I'll add too, they had to pivot, as you can imagine, during COVID. Yep. So both of them were offering cooking classes also, and normally they would offer those. Their plan was to offer them face-to-face, and they offered them virtually instead. And they had thousands and thousands of participants. I mean, that was one of the libraries will say that is one of the positive things that happened from some with them having to close the actual libraries for a while, was that they had to get creative, and they actually had more participants participate in some of their projects, some of their programming than they would have normally. And so those cooking classes are just one example that the reach was even farther than it normally would have been.
Mm-hmm. And one other thing about Cedar Rapids, they had mentioned that because they had this partnership formed through this project with the local public health department, through the COVID vaccinations, they were able to, the health department reached out to the library and provided them with flyers that they were trying to get out to the community. And so the library included those flyers in every drop off pickup book thing that they have going on. So that was just a great collaboration already in place that they were able to utilize to get that information out too.
So moving forward, just like this webinar, what we're trying to do is more outreach and education for other communities about this relationship. Even if it's just an informal, spreading it more statewide. I mean, really, that's our goal, is to really start to enhance that that collaboration between the local public health and the libraries. And the two libraries are so, they're as excited about it as we are. I'm so used to, and I know you guys probably are too, used to like trying to reach out to other local organizations, or let's collaborate. And sometimes it's just like reaching, hitting a wall. But the libraries, they just don't say no to us. They just, and so we're going to talk a little bit in a minute about some of the work we're trying to do with the state library. And it's the same situation, is that they appear to be as excited as we are about this. Abby, go ahead. Yeah. So here, working with the state library, we also applied for another Telegen grant. To start, the state library is very similar to the state health department, that they are the umbrella of the local libraries across Iowa. There's how many libraries, Abby? 563?
543.
Okay, 543. And so the difference between a local public health and a library is that the libraries are generally city governed, while, except for a few exceptions here in Iowa, our local public health are county. And so the state library is that umbrella, and they have a number of vehicles and ways that they communicate with the libraries. They offer webinars for CEUs. They have a delivery program that they deliver different resources to all the libraries. They have newsletters, all kinds of different things. So we wanted to tap that vehicle with the state library to see if they were willing to partner with us to make this project, again, to try to move it towards that statewide vision. And like I stated, we talked to the staff over there, and we did not end up getting the grant because actually one of the comments was that it was not sustainable, which is ironic because now we're doing it without even the funding. So we are having continuous conversations with staff at the state library and how we move forward. And one of the things we did, just like Abby talked earlier, we surveyed the libraries and those local pilots to see what they were looking for. We also did a survey because we really want to meet the libraries, meet the needs of what they need from us. And so we surveyed, the state library sent out a survey to all the libraries, and we wanted to keep the survey short. So I think it was like 8 questions or something. Mm-hmm. Yep, just to see the best way to serve them. So the survey was conducted with Iowa's public libraries to gauge their interest in offering resources developed by public health within their library. We had 133 responses back, and they only promoted the survey, I believe, once. So I was extremely happy with that response. And we got 1 that said no. I'm not sure, maybe that person was having a bad day. But, and then we had 9 not sure, and I'm sure that probably they didn't understand what we meant by that, or what we were asking, if we were asking them to do more work, probably. So we were very excited that over 92% said yes. So here were some of the topic areas that they were the most interested in. Nutrition and physical activity. So we've already started the conversation with our nutrition and physical activity staff at the health department and how we move forward with that. We're looking at bookmarks, coloring books, some training classes being offered, webinars. The librarians need CEUs, and so the state library is always looking for ways that they can offer more CEUs. So we're looking at that. Mental health and substance abuse is going to be one of our, it will be definitely in our top 5 that we start to collaborate with them on. And you guys, you can see here, community resources. So I've already reached out to 211 here at United Way and how we can start to work with them on that. And then even at the bottom, COVID-19 resources. So we have a long ways to go with that. So we will be talking about COVID for a long time, and the libraries could be a great way to help us with that. And then we asked them how they would prefer to receive this information. Webinar, they said 18% we're gonna do webinars, even though they said only 18%. So, because I think that's the best way for them to really hear and listen to what we're offering. Newsletters, email. So, and then we had all of these. Abby, what is this?
I know, I'm trying to. Okay,
Oh, how we asked them how yeah. No, I'm sorry, that's my bad. We asked them how they wanted to receive the information, them as librarians, and then how they would like to also share the information out to their patrons, because those, how they receive that could be very different. So as you can see here that online resources, I mean, the libraries have become, and I think that they have learned to embrace that, as an IT, that they offer IT services for community members who may not have that the ability. And so being able to direct them online, webinars, written materials. So very similar to, I think, how they said they'd like to receive their information.
Okay. There we go.
And, you know, I knew that we'd probably get through this quickly. I talk really fast, especially when I'm excited. So, and I just, again, want to really emphasize the value, you know, both our local pilots have told us, again, that this relationship is going to continue. Cedar Rapids is already calling on the libraries to ask about how they could help them with the, you know, vaccine hesitancy in their community, and the libraries are ready to embrace that and to help them. So this relationship will continue to build and get stronger as they move forward, and we could not be more happy with that. That's really what was the goal and the hopes of this project.
Does anyone have any questions or comments?
So we have a question about with Delta Dental. Delta Dental is actually, their foundation is, they have two different, and Abby's gonna have to, Abby's better with the details than I am, that they have two different types of grants now, and one is an oral health focus, but one is more of a community wellness focus. And so we were able to, we applied under their community wellness focus to be able to receive the funding from Delta Dental.
Anybody have any other questions?
Thanks for the question, Arlene. I'm going to jump in with my own question related to that before we get to Sonia's real quick. Because while we're on the topic, I was wondering what other local partnerships have helped, are helping, or could help in the future with implementation of this project. Not necessarily oral health related, just any partnerships, grocery stores, to stock fridges,
Certainly.
anything like that.
I mean, obviously, and every community is different. And that's one reason why we really wanted to put it in the hands of the community and how it was tailored. So you can see the relationship. Perry has a pretty tight-knit community, and the library has already tried to build on it in Perry. And I don't know that she had a very good relationship with the local public health, because the local public health is actually in Dallas Center, right, Abby?
Yep.
So
Adele.
Okay, so anyway, so they weren't in the same town, and so they had to, this was a new relationship for them, and I think that it's actually then helped our local public health too to really make some of those inroads in Perry because of the relationships that Perry had with her community. But yeah, she worked with the grocery store, and I know that that Mary, who heads the library there, worked with Eat Greater Des Moines to get some guidance on the food recovery program. But she works with the police departments in Cedar Rapids. They have, you know, the homeless shelter there that they work strongly with. I know that, and I'm having a total brain lapse. I'm not feeling very good today, so bear with me. Iowa State Extension, they both are working with their Iowa State Extension for the nutrition classes. So there is a pretty wide communities collaboration even beyond the two partners.
Okay, thanks. So we have another question from Sonia, and she's asking about the Cedar Rapids worker, their service support service navigator. There we go.
So the question is he a social worker, and is he a full-time employee of the library through the grant? I believe that he works, I think I've heard 30 hours a week, and it might be split between the over the shelter and the library, but do not quote me on that. And yes, I'm not certain either if he's a social worker.
I don't know what his education background is, and we could certainly find that out. But he does, and I believe that they share part of that relationship with the overflow homeless shelter too. So that, no, there would be no way with $25,000 that they were able to fund him full time. But I think that they had this grant had spurred them. They had talked about it, and so it is what started the conversation with the overflow shelter to fund this position. And so again, now that the city is putting it in their budget, they won't need this grant any longer to do so.
If anybody has any other questions, make sure you put them in the chat. But in the meantime, I'm going to take a step back real quick and just ask a very general question, which is what is the current state of this project? I know you said at least Cedar Rapids, and I don't remember if that applied to Perry as well. That project, the funding anyway, was extended through, I think you said next month, May.
May, yep, the end of May.
Okay, so what's the current state of the project, and what would you like to see in the future from this project? How do you plan to sustain it in these communities or elsewhere?
So the two of the projects again are just ending, and they're sustaining it through their own resources. Woodward has only just started, so and we are constantly looking for more funding, and we're looking at some of the federal grants coming down right now. We would love to take this statewide, even if we're not offering like direct funding through the pilots, which is the ideal, and so we will continue to look for it that way. But that's one reason why we've reached out to the state library also. I really think that once the conversations start happening between libraries and local public health, that they can again help each other serve their communities and meet their missions and so it's a win-win for both local public health and libraries to start these conversations and this collaboration.
I think the more we talk about it with groups like this, and the more like we get the word out, I think people are very excited about it, and it's just it's a fit that this partnership should happen. And so I think just even like hearing the success stories and the programs that have been added in Cedar Rapids and Perry will just spark ideas and interest in all communities across Iowa, we hope eventually someday.
I'm originally from a small town in Iowa, and one of the reasons why I loved this project and loved seeing it come to fruition is that I know in the small town I was from, I mean, that's where people went, was the library. It really was a community hub. And so what the needs in a rural area and the needs in an urban area may look completely different. Before I took this position, this current position that I'm in, I sound like it was just yesterday, but I've been in this one for like 10 years. But before that, I did Hawkeye outreach for the state. And I always encourage the local coordinators to reach out to their libraries, because if there was a factory that closed down in the community, I mean, those librarians frequently by default are the town social workers without even a social work degree. I mean, they know what, there's so many people in their communities that they know what's going on and they know who it's impacting. And I don't think that they always know then what to do with that information. And that is really where another place where that's collaboration can help the community and the members and the individuals within it.
Yeah, that is it's a very exciting partnership. And that you kind of got to another question that I have. And again, anybody else who has questions, put them in the chat and we'll get to them. A question that I had about, like you said, how the different resources that you can provide, or that different local public health, different libraries, different communities need, it can vary widely across the state. So what are the different ways that these programs can address social determinants of health in different parts of the state with sometimes very different populations, both in size and makeup?
Well, and again, I don't know that library, and I don't know. I mean, I'm coming from a public health background and just somebody who loves to hang out at libraries. So I don't know that librarians, they necessarily have the demographic backgrounds that local public health does. So they are responding to what they see in their library. And so those social determinants of health, again, I mean, just like Cedar Rapids, they couldn't ignore the homeless population in Cedar Rapids. I didn't realize until we went and started spending some time in the library how the significant homeless there is right there at that library. And so, you know, I think that libraries deal with the social determinants of health that come in within their doors that they can see, right? And public health, we're looking at data and different things. And so you know, there's different ways and tools that they can use internally to address those social determinants of health. And, you know, a lot of the libraries were already doing it and they didn't know to call it public health. And sometimes I think that they were just kind of going into it blindly. When we went into Cedar Rapids Library, they already had treadmills in their reading areas for people to be walking while they were reading. When we went and visited Perry, they rent out bikes. So, and they told us that people would come in and ask about the safety of immunizations, and they would just direct them to, you know, the computer and suggest some websites that they were familiar with. And so this is an opportunity for, again, local public health to really give them the good information about public health and health in general, you know, scientifically valid information. And then for public health to reach maybe populations that we have a tough time reaching. For instance, when I did Hawkeye Outreach, we had a tough time reaching kids who weren't in school yet. You know, we had partnerships with schools, but there are kids under 5 who may not have had a touch point with the schools yet. A lot of those families show up at the libraries for reading programs and different things. And so libraries, especially in smaller communities, are where people, you know, over 65 frequently go also. So there are the age groups and different populations that may not touch in the traditional systems that public health touches. I just totally went off on a tangent there. I'm sorry. So
oh, that's
I mean,
great.
I think that, you know, every community has a different social determinants of health. And again, all we can do, I mean, this partnership is gonna, we're both working in different silos. And I think that once our visions come together in those communities, it is only gonna enhance what can be done.
Well, tangents like are great. Go on some tangents. Yeah.
A question in the chat: is there any outreach regarding COVID vaccines and signing up the homeless in the libraries or bringing the vaccine to them? I think that's a great idea. I did mention earlier about the libraries handing out the flyers with their book pickups about the vaccine information around the Cedar Rapids area. So I do think, I think this is what's on everyone's mind right now, so I'm sure it's all happening that we're not even aware of across Iowa, maybe in libraries, but yes, it's a great idea and bringing the vaccine to them. I like that too.
And they trust libraries. People trust their libraries. And so it is a great place for us to look at those again. I'm saying like a broken record here, those partnerships. Mm-hmm. Abby and I have hosted for different, I always joke we're kind of special projects at IDPH that when there's a new project that they don't know, it doesn't really have a place where it fits, it gets brought to us. And so, which I love because we change what we work on all the time. So, but we have had to organize a couple times on like regional meetings or focus groups across the state for various projects. And I always say, let's do it at the library. Because that is, especially in rural communities, that is where people are used to going. They can have their coffee. The only bad thing is their hours sometimes make it hard for us to be more accommodating, and they're very strict about their hours. But it is a great place for us when we want to go into new communities for us to be at the heart of it.
And at the Iowa Conference on Public Health, there was a breakout session on this project, and both of the pilots presented at that. So if you're interested in, there's recordings of that if you're interested in watching it, if you haven't already.
So what I would love to know, if anybody out there, and you don't have to if you don't want to, obviously, but if any of you who work for local public health, what do you think about this? Because I know that, just like local public health, some of our libraries are only open a few hours a week. you know, and they're short-staffed and understaffed. I would love to hear how you think that we could help that partnership be better and make it easier for the two of you. Does anybody have any ideas?
You can unmute now too. Anybody that would like to, by the way.
Well, if you think of any, just let Abby and I know. She had the emails there. We would love to hear and get input from our local public health too, that are outside of those areas.
And we make sure that you get the slides to click on the links and everything too. Does anybody have any other questions?
I have kind of another general question. That is, oh, there's a question. We'll get to Sonia's first. Okay. Then we can, if we have time, we'll take a step back to mine.
So she says, I am a public library director, and I guess I would ask public health folks, are you at a point where you have time to discuss non-COVID partnerships?
So Sonia, I think that, like similar to libraries, none of our local public health look the same. We have ones that have multiple programs and multiple staff, and we have ones that, you know, are smaller with so it really is going to depend in which area you're in. I would not hesitate in reaching out to them though, because I mean, there's no harm that will come out of it, and especially if you are offering to help with those the COVID response. I mean, we are really going to be working on the immunization hesitancy in the near future. I mean, we already are, obviously, but that is, once we get through that first, you know, wave of people who are waiting to get immunizations, then we're going to have to start tackling those who aren't. And I think that libraries, again, are a great place to help us get out factual, scientific information on that.
And I know we mentioned this earlier, but we are working with the State Library of Iowa, and they're kind of we're working with our nutrition staff too, and it'll be like kind of in line with the summer reading program to push out the like bookmarks and coloring pages. So you'll likely be getting information on that before the summer, on some resources that you can have that IPHA has developed for free. So that should be coming your way. Some of them, there's a lot of like print off sheets you can print off and offer in the library, just black and white ones. And then there's also books and all sorts of stuff.
We're really, well, I'm excited about everything to do with this project, but again, working with the state library, I just keep on waiting for them to say it's enough, and they don't. And I'm just amazed at how willing both the pilots, all three of our pilots, and the state library has been on this with us. How receptive they are.
Hey, you guys, this is Chrissy. I have a question. I'm fairly new to public health, but I work for the medical board. And so we don't really get to see all of these aspects of public health that are so awesome that you guys do. And this isn't really a suggestion as a public health employee how to better the program, but I'm wondering if there's somewhere like on our portal that maybe we could develop some kind of a volunteer area where that you guys can put, you know, these people, there are gaps with these grants and they need volunteers, so that people like me who are outside of, you know, the Lucas building and, you know, up there with everybody, that we can maybe have an opportunity to find out more about these programs and maybe sign up, or maybe lead us to where we can go to sign up for them.
We'll definitely look into that. We have no control of the portal, probably good.
Oh yeah, right.
But I would ask about that because, you know, I mean, just off the top of my head, you know, United Way has a huge volunteer arm. So even if we did something where we could connect state employees that are in the Lucas building on how they can reach out to United Way, I think that's a great idea.
Yeah, I do go on Volunteer Iowa website, and they have tons of opportunities on there. But it would be really great to know what our department's working with, and then that way we can still network within our department and have
Sure.
other opportunities within the department to maybe do outreach from places
that'd be
where
great.
like me. So
That would be great.
so
Definitely.
who should I ask about that? About the portal stuff? Maybe Kelly
know.
Garcia or somebody.
Sure. You could ask Kelly.
She'll probably be like, that's going to the look at later mailbox. But anyway, okay, I thought I would
think that's
ask. All right.
No, I think that's great. I mean,
Okay.
I would love to see state employees have the opportunity to volunteer more
Yeah.
within our own umbrella. I mean, we do it, and a lot of us do it on the weekends and nights and stuff, but it is definitely, and I know some of the bureaus at IDPH do it as a team building activity within their bureaus too, but it would be great if we could see more of that.
Okay, thank you.
This is Arlene. I want to respond to Chrissy's statement too. I think I read that the legislators unfortunately did not vote for, I think it's a bill to do a public health registry for the state of Iowa, and unfortunately it died. And I think that would be very helpful in regards to what she's talking about, and just, having a registry of who is in public health, and people like myself who are retired but still are very much involved in public health. It would be very helpful to have that registry, I think, across the state. And then secondly, I think it would be a nice idea. One of the things that I do as an offshoot, a different thing here in the community is called Pet Pals. And we, work with our pets and take them and their therapy dogs and cats and that kind of stuff. But the point what I'm trying to bring into is that the people that work at John Deere, for instance, they have what they call, it's a program called Benefiti. And so if they put in volunteer hours, like let's just say they're taking out their therapy dog and they do their volunteer hours, it's matched by John Deere, and then they can give it to whatever charitable community they want. So, I mean, we actually earn money from some of our volunteers who actually volunteer, and then they record it, and then we get the dividends from that. And I mean, it's significant. There's been some times where we've had hundreds of dollars from people volunteering. So I think that's another aspect that maybe as public health people, we don't do really well. And I think we need to start thinking about that more, of partnering, or at least being able to somehow being reimbursed for some of our volunteer hours that we can actually give to our public health agency or whatever charitable agency you want to go to. So
It's a great way to think outside the box. I mean, I love blowing up boxes. So anything you guys can, I mean, this is just our communities depend on public health. We have so much to offer. So that's great. Great idea.
Yeah, thank you.
Well, if anybody else has any more questions, unmute, put them in the chat, whatever. I'm going to go back to a fairly general question. I think this has been kind of touched on now by Chrissy, Arlene, Angie, Abby. All of you have now sort of gotten to this. So if it's redundant, then, no need to be redundant. But I'm just curious. Obviously, funding is can be a major factor in a partnership like this. Of course, a $50,000 split grant helps the communities implement something like this. But what are ways that, on a more regular, attainable basis, that LPHs and libraries can partner to help spread public health information or anything else to individuals of those communities?
It's easy for me to say at the state health department, and I always try to be conscientious of that I am not working on a local level, even though I love to spend as much time with locals as possible to understand it. But I really think this can be a win-win, that this relationship can help both agencies meet what some of their requirements. They both have requirements to conduct outreach in their communities. And they're both working with different focuses and maybe different populations. And so by braiding those two efforts, it really can be a win-win. And one of the initial thoughts that we had, just the initial conversations, is our local public health or local libraries. I don't want to put the burden on either one because I understand again that they both, many of them are understaffed, underfunded, but to reach out in the China HIP process. Ask the local library or the library's call and say, I want to be part of the health needs assessment in your local community. I don't think there is a lot of libraries involved in that process. And they would add a interesting perspective to it, voice to it. Do any of the local public health have any thoughts on that? Or libraries? I was excited to see somebody from a library was on the webinar, so.
This is Sonia, and I'm from the Ottumwa Public Library, and we just happen to be going through a strategic planning process because our current strategic plan is up, and we utilize the state library to advise us on that. And one of the processes that we use is we do like focus groups, and we aim to have stakeholders from throughout the community, some that use the library and some that have never stepped foot in the library, to see what we could be doing differently to get them in the library. And so I think that by just participating in today's call, that I will make sure that I have a stakeholder from the public health that participates when we do our next stakeholder. That doesn't mean we had funding to do, all the great ideas or to implement them, but it does mean that we at least get that point of view of what we could be doing differently. And the reason I asked about the social worker was that when we're doing research in modern public library activity, there's a lot of metropolitan libraries that have full-time social workers on staff, and those of us in medium to small public libraries just can't afford to add that focus, because they would have to do wear a lot of different hats when you work in a small library. So
yep. And health navigators, that's kind of a broad term. That's a fairly, it's not new, but it is a fairly new occupation too. And my guess is if he was a social worker, they would have called him a social worker, would be my guess. So as a health navigator, those are frequently people that are local public health. We might even call some of the people that work in-house health navigators that help navigate some of the residents towards their resources to address their social determinants of health in the community. So I don't know that for sure, Sonia, so I don't know that he's not a social worker, but he very likely could not be by using that term, the title health navigator. And I used to live in Ottumwa briefly. My dad ran the Long John Silver's there when I was a kid. You guys have a beautiful library. We've had some of our regional meetings and focus groups at the Ottumwa Library. It's a very nice library. So that is very exciting you're on. So Arlene said that a lot of times the health, they have a BA, they have a BA, health education BA degree. Thank you, Arlene.
Yep.
All right, does anybody else have any more questions before we wrap up here for the day?
Well, thank you, Brett, for helping and for asking all your great questions.
Yes, of course.
Yes,
thank you.
Thank you, everyone.
Yeah, thank you, everybody that came in today and helped contribute to this conversation. I think this is a really interesting and important topic that I think it's important to spread this information throughout the state. So it's great that we were able to host this and try to spread it as much as possible here. We had a decent crowd, and so that's really nice to see.
And obviously, Abby and I love this project. So all you guys have to do is reach out to us. We're happy to help in any way we can. And I know the local libraries, if you even want to pick the libraries or the local public health brains too, they're just as excited. Mary and Perry makes me, she wears me out. She has so much energy, and that's a rare thing to find. So she would love to talk to anybody about what she's doing.
And did you say you will make these slides will be available? The slides that you had, if anybody wants the links or anything.
Yeah.
I think Zoom will. I think I can see who was in here, and so we can email that out.
Okay.
Yeah, we'll get that done shortly after then. Well, thank you, Angie and Abby. for sharing all of this great information. Thank you, everybody that was here, spent your lunchtime with us. And we hope to see you all again next month. I think it'll be the 20th next month will be the next third Thursday. And in that one, we'll learn about the COVID takeaways from the State Hygienic Lab with Sherry Marine and Beth Hochstetler. The Education Committee is still looking to plan topics for the next season. So this season ends, I think, June. We're planned through June for these lunch and learns, and then we'll start again after a little break in September. And we're still planning topics then. So if you'd like to speak on anything that you have, or if you know of anyone that you think has an interesting enough topic or something that they would like to share, let us know. You can email me. I'll put my email in the chat. You can email me or anybody at IPHA. And we will see if we can find a time to get you into the schedule. And just a quick reminder, as a nonprofit organization, IPHA relies on membership dues and sustaining donors to support a mission. If you're already a member, we thank you greatly. And if you're not, we can please consider joining. We would love to have you. Students, if there's any students in here, I'm not sure that this one was necessarily aimed at the student population, but if there are any in here, I'm glad that you're here. You can check with your department chair. Some programs do have funding for membership. If you are a member, thank you, and we appreciate any donation that fits within your budget. This recording will be archived on the YouTube channel where you'll find any other webinars you may have missed. We'll try to get that up there as soon as possible. We've fallen a little behind the last couple months, still need to go up, but they're in the process of doing that. This will be up there soon too. So thank you again, Angie. Thanks, Abby, everybody else that's here.
Thank you, everyone.
It's been a great time. All right, hope to see you again next month.
Have a great day.
Bye.